Hello everyone, welcome to Ezinurse. In this session, I'll be talking about meningitis. It is the infection and inflammation of the covering layer of brain and spinal cord called meninges. If it is remained untreated, it can be life-threatening. So let's discuss about it. Meningitis means infection and inflammation of the covering layer of brain and spinal cord, which is meninges. It can be happen due to bacterial, viral, fungal or even parasitic causes. In between them, the bacterial cause is the most fatal and life-threatening. Let's see what are the types of meningitis. So based on the causes, there are 4 types, which is bacterial, viral, fungal and parasitic. So the viral are the very less dangerous, whereas the bacterial one are more severe and more life-threatening. The parasitic and the fungal one can be seen in the immunosuppressant patients. As an example, the meningitis can cause because of bacteria like Streptococcus pneumoniae, Neisseria meningitis, viral such as enterovirus, herpes simplex virus, fungals such as enterovirus, and parasitic such as Naegleria fowleri. So what are the risk factors are there to getting triggered by meningitis? So it is mainly seen in infants and elderly. If a person is getting immunocompromised, then he have a chance to get the meningitis. Crowded living like dorms or military or even in a camps and hostels. Lack of vaccination such as meningococcal vaccine. Lastly, the skull fracture or any central nervous system procedures or surgical methods. Let's see what happens inside the body during meningitis. So first, the pathogen will enter the bloodstream. It will pass through the blood and brain barrier. Then it will get infected and inflame the meninges layer, which will lead to increase of the intracranial pressure, and that will damage our neurons, or neural damage will happen. Signs and symptoms may differ by age. In adults, we can see sudden fever, neck stiffness, headache, nausea, seizures and photophobia. In infants, we can see the symptoms such as bulging of the fontanelle, poor latching or poor feeding, high-pitched cry and even seizures. Let's see how to diagnose meningitis. We can do it by lumbar puncture to collect the cerebrospinal fluid, complete blood count and blood cultures, CT scan and MRI. So when we are doing the cerebrospinal fluid analysis, in the case of bacterial meningitis, we can see the decreased glucose level, increased protein and increased WBC or white blood cell count, which is also called as neutrophils. But in the case of viral meningitis, we can see the normal glucose level, but the lymphocyte count will be increased again. The management depends on the causes. If it is bacterial, then we can go for antibiotics such as corticosteroids, and we can do the hospitalization for the patient if the case is severe. In the viral meningitis, we have to give the antiviral drugs and also along with the symptomatic treatment such as providing rest, IV fluid administrations. The complications of meningitis include hearing loss, cognitive impairment, seizures, septic shock and hydrocephalus. Prevention is always better than cure. So let's see how to prevent meningitis. First and the most important one is vaccination such as HIV, meningococcal and pneumococcal vaccine. Next is treat infection early as soon as possible, along with the prophylactic antibiotic for the contacts. As a nurse, we have to monitor vitals and neurostatus of the patient. We have to maintain the hydration of the patient, intake and output chart of fluid. We have to administer the medication on time, maintain the hydration of patient, and lastly, reduce the environmental stimuli which can trigger the patient's symptoms and complications. To conclude, I can say meningitis is a life-threatening situation, but we can save life by using prompt decision, proper diagnosis and proper treatment of the patient. Thank you for listening. Stay tuned with Ezinurse.